Tonight, full-blown crisis. Checkpoints at provincial borders with Ontario to fight the COVID onslaught.
There are few options left.
The toughest restrictions yet in the province hardest hit.
I still feel that we're too late.
Desperate appeals for more vaccines and hospital staff.
We need people that are trained to work in ICU.
We're not going to be able to provide them with support.
The end of the Castro era. An historic handover in Cuba.
I don't know if the name will ever fade to the background.
Plus, remembering the prince in, of all places, a pub.
You'd always acknowledge the flowers and always say how nice they were.
Royal reflections from a local watering hole in Windsor.
CTV National News with Lisa Laflamme.
Good evening. We begin tonight with the disaster scenario predicted months ago and playing out right now. Across the country, 41 families are mourning the loss of a loved one, and 9,300 more Canadians tested positive. Once again, Ontario broke its daily case count at more than 4,800 new cases. The crisis triggered provincial border closures and police enforcement. CTV's Mirella Fernandez on the new restrictions and the reasons.
We're losing the battle between the variants and vaccines.
Stuck in the middle, the people of Ontario, who will face tougher restrictions for even longer. A province-wide stay-at-home order is extended until at least May 20th. Starting tomorrow, all outdoor recreation sites like playgrounds, basketball courts, and golf courses will be off limits. Essential retailers will operate at 25% capacity. Construction projects will be limited. And starting on Monday, provincial borders will be patrolled.
There are 43 different road pathways through Quebec and Manitoba, and we want to check those visitors. Why are you coming into Ontario at this time?
Healthcare workers have been calling for tighter measures, but some say these aren't the right measures.
The modeling was very clear. The same people are getting nailed over and over again, and this does very little to protect those individuals.
Those individuals are essential workers, and that new modeling has frightening projections.
But the biggest problem we now face may be that we're just too tired to notice. So I'm begging you as part of the team to notice.
In the worst-case scenario, with weak public health measures in place, Ontario would have seen more than 30,000 cases a day by early June. Under current measures, described as moderate, the province was expected to see just over 10,000 cases a day in June. With stronger measures, fewer than 4,000 are expected by late May, early June. The outlook is based on administering 100,000 shots a day, or enough to fill Toronto's Scotiabank Arena 5 times. But in the last week, Ontario has only hit that 4 times. Ontario's premier blames Ottawa.
We aren't getting out of this. More people are going to die. More people are going to be in ICUs. But if we can ramp it up to 300,000 a day, then again, you will see the drastic. So this is 100,000 up there. This is if you do 300,000. It's night and day.
The federal government is promising more vaccine and help getting them into arms.
We are standing by to deploy the Canadian Red Cross to help with their mobile vaccination teams. This is about getting doses to people where the situation is most serious.
Ontario has not accepted that Red Cross offer, but the Premier did say that 25% of future vaccine shipments would go to health regions being crushed by the third wave. Lisa.
All right, Mirella, crushed is the key word tonight. Premier Doug Ford did put out a medical all-call for help from other provinces, but so far isn't getting a lot of takers. A record 701 people are in intensive care tonight. That's more than half of all ICU admissions across the country. 3,800 Canadians are in a hospital bed or hallway tonight. CTV's medical specialist Davis Favreau looks at the shortfall in space and staff.
2 large Toronto hospitals are opening up tents to handle an influx of patients waiting for the ER. The latest field hospital in the region will open early next week, a necessary measure for the relentless surge.
It's awful right now. It's awful in the community. It's even worse in the hospitals right now. The people that we're seeing that are coming in are very, very sick.
Ontario has put out the call to all provinces for help. 620 healthcare workers are needed, including 500 nurses and 100 respiratory therapists. The Canadian Medical Association says that as the third wave worsens across the country, a national program is urgently needed.
Some very gut-wrenching, difficult decisions are going to have to be made in order to save lives.
Ontario, meanwhile, repeated promises to bring in retired and graduating nurses to help.
And we are also looking at some international jurisdictions as well to bring in the several thousand more nurses, respiratory therapists, and anesthesia assistants.
But the fear is this call is coming too late.
You cannot just redeploy people to an ICU. It doesn't work that way. Critical care nurses and respiratory therapists and physicians are so difficult to train that can't happen overnight.
Some provinces have offered assistance, but some have not.
We just don't have the capacity to start even talking about loaning our healthcare workers out.
Meanwhile, some Ontario nurses have already had to leave the profession, lacking support.
I have a friend, she has 4 kids, toddlers, and school-age children. She had no choice, but she had to quit nursing. With school closures and everything going on, it's so hard to keep working because you have no support to look after your children.
It's painting a picture of a crisis, Lisa, with no signs of slowing down.
Oh, frightening. Avis, thanks for this tonight. Outbreaks are plaguing other provinces also. At least 151 inmates and staff at the Regina Correctional Center have tested positive. And last night we told you about Iqaluit's first case. Now it's up to 13.
I expect that Iqaluit's COVID case count will rise, so please don't panic when you hear the daily numbers.
The cases are in multiple households and the source of the infection is still unconfirmed. On the vaccine front, Health Canada is reviewing a Pfizer submission to expand its age criteria to kids as young as 12. They're not yet eligible. But a record 324,000 Canadians did get one of the approved shots today. So far, about 8.6 million people have had at least their first dose. Ramping up that number may have hit another snag, though. CTV's Kevin Gallagher has details.
Potentially life-saving shots like these will stop this Sunday at 2 more Toronto vaccination centres, as several clinics across the hard-hit region have been forced to shut down over a lack of supply, a situation that could get worse.
We are concerned about the delays and the production challenges around Moderna.
Moderna may cut up to 2 million doses from Canada's supply over the next 10 weeks. The next delivery, which was already delayed, will now be slashed to 650,000 doses instead of the promised 1.2 million.
We will continue to press Moderna and all of our other suppliers to do everything possible to respect their delivery targets.
While disappointed, the Prime Minister says Canada has found other options.
Canada has now signed an agreement with Pfizer for 8 million more doses of the vaccine. This is on top of what we have already purchased.
This means Pfizer will ship more than 2 million doses weekly in May and 2.4 million a week in June, with Johnson & Johnson sending their first shipment of 300,000 by the end of April. Canada's total could reach up to 50 million doses received by the end of June. Vaccines are sent to provinces on a per capita basis, a strategy the mayor of hotspot Mississauga, Ontario, wants to change.
I had a conversation with the Prime Minister last night. We had a great conversation. He asked me what was missing, and I told him it was allocation and supply of vaccine.
The Premier of Nova Scotia rejects the idea.
It's incumbent on us to make sure that we say to the federal government that we expect to get our vaccine.
Today, the Prime Minister wouldn't say if he'll redirect vaccines, only that he's open to it, Lisa, if the provinces can agree.
Interesting. All right, Kevin Gallagher in Ottawa. Of course, a vulnerable supply chain is an opportunity for scammers. At this pharmacy in Repentigny, Quebec, police say a man posed as a vaccine inspector, fake documents and all, to try and access their supply. Staff were onto him and called police. The pandemic has done nothing to quell the number of mass shootings in the United States. The latest, a FedEx facility, the 45th massacre in just 30 days. CTV's Washington Bureau Chief Joy Melvin has the details.
There is nothing but grief here as families wait to learn who survived and who did not.
We have an active shooter currently at FedEx.
After a gunman stormed this massive FedEx facility in Indianapolis last night, armed with a rifle.
There was no argument. He just appeared to randomly start shooting, and that began in the parking lot, and then he did go into the building before he took his own life.
It was fast and it was deadly. In a matter of minutes, 8 lives lost and several people injured.
This is awful. This is awful.
Leaving survivors stunned.
We started hearing 6 to around 10 shots, and I saw a man with a submachine gun of some sort.
I don't know why would they bring guns to work, or why would there be an argument so bad that they get to shoot.
Searching the suspect's home, police identified 19-year-old Brandon Hole as the shooter. A former employee at the FedEx facility, the FBI questioned him last year after his mother thought he might try to commit suicide by cop.
Last night, Indianapolis was revisited by the scourge of gun violence that has killed far too many in our community and in our country.
Racked by mass shootings, the flags in America, it seems, are always being lowered. Clearly frustrated, the president urging lawmakers to act.
Every single day, there's a mass shooting in the United States. If you count all those who were killed out on the streets, it's a national embarrassment and must come to an end.
While officials search for a motive, yet another community is grappling with tragedy. On the same day, 14 years ago, of one of the deadliest mass shootings in U.S. history, Virginia Tech. Lisa?
Never forget that never-ending tragedy. Okay, Joy. There's a recurring theme in U.S. relations with Moscow tonight. Russia's foreign minister today expelled 10 American diplomats in retaliation for U.S. sanctions against Russia for election interference. In communist Cuba, seismic change. For the first time in 62 years, the Cuban leader will not be named Castro. Tom Walters explains.
Viva Cuba Libre! Viva Fidel!
With words of revolution, Raul Castro goes into retirement, stepping down as leader of Cuba's only political party. Raul followed his brother Fidel into revolution in the 50s and into supreme leadership a decade ago. Now expected to follow him into the top party job, Miguel Diaz-Canel, who has already succeeded him as president. What's not likely to change? U.S. policy toward Cuba.
Support for democracy and human rights will be at the core of our efforts.
Under leaders named Castro, Cuba has remained a time capsule of Cold War communism. But where a weak, centrally planned and sanction-burdened economy has been hard hit by COVID, Cubans are getting frustrated with long lines for food. Every day is worse, this woman says. And where not long ago, Fidel and Raul sang the Internationale, artists now rap calls for more freedom of expression. So Castro's groomed successor faces growing pressure for reform. While Diaz-Canel is expected to be cautious about change, and while Raul Castro is sure to remain influential, something has changed all the same. At 60, Diaz-Canel was not even born when the Castros seized power. So now, like much of the country, Lisa, the leader tending the flames of revolution in Cuba has no personal memory of how they started.
Wow, fascinating transition. All right, Tom. Time for a 2-minute break, but when we come back, a depraved and dangerous act.
It's shameful.
A sordid and sleazy retirement party at an Ontario construction site. Half a dozen Ontario construction workers have been fired for gross violation of the Workplace Code of Conduct and general decency. John Venevale-Rao in the graphic video of a retirement party.
Mattamy is the biggest builder of new homes in the country, a company now launching a review following stunning behavior at a job site, after images surfaced on Twitter of a party showing drywall installers and what appears to be a stripper dancing with the men who watched and touched her inside a home under construction.
I don't think we can speak out harshly enough on this incident. I think it is a black eye for the industry.
In one image, you can see a bottle of vodka, and no one was social distancing or wearing a mask, at a time when the number of COVID cases in Ontario are soaring.
On top of a violation, you've got an actual incident where health and safety has been affected.
Around the construction industry, shock and disgust. Mattamy Homes, the developer, says the incident did not involve its own people, rather subcontractors and an employee of a trade partner, Nelmar Drywall, which says all the men were fired. A lawyer for Nelmar wrote they violated several rules, as well as its general company philosophy and values. Mattamy says it had no prior knowledge of the event and added the individuals in question behaved in a grossly inappropriate and reckless fashion.
I think it's disgusting, it's shameful, and most importantly, it's demeaning to women.
Those fighting to see more women in the construction industry say the incident will only serve as a deterrent.
An incident like this kind of just takes us 10 steps back.
Though some hope it'll trigger more change in the industry. John Venevale-Rao, CTV News, Toronto.
Still ahead, a community campaign for Indigenous immunization. Resolve and relief as the First People of Canada are among the first in line. Pop-up vaccine clinics in hotspot neighborhoods are starting to make a difference. As part of our Indigenous Circle, CTV's Donna Sound reports on an urban community helping its own.
They lined a whole city block waiting to get their COVID shot.
About 45 minutes, and counting.
The Native Canadian Centre in downtown Toronto is host to this mass vaccination clinic. They're expecting 500 people at this clinic. It's a concerted effort by community leaders concerned for community members. Indigenous organizations in Toronto banding together, headed by Anishinaabe Health.
Rather than just keep it sort of siloed, we opened it up more for the entire community, the entire Indigenous community.
Doing their part to stop the spread of this deadly virus and vaccine hesitancy that has come with it.
Take a deep breath. 1, 2, 3.
The number of people here is proof that their work is paying off. In today's COVID update, the Indigenous Affairs Minister had some welcome words for these frontline workers.
Indigenous communities are crushing the curve.
Leslie Saunders works tirelessly with her colleagues to make this happen. She says reducing barriers to access to the vaccine is key.
So this creates an atmosphere where people feel welcome, they feel safe, they feel encouraged. They know that there's a lot of culturally safe practices going on here.
Care kits are also given out, complete with hand sanitizer, traditional medicine, and information on follow-up care.
I think it's important that everyone get vaccinated.
Anishinaabe Health will continue its mission to vaccinate as many Indigenous people in the city as possible. Donna Sound, CTV News, Toronto.
And we have a very sad passing to report tonight. Actress Helen McCrory has died after battling cancer. So well known for her roles in Peaky Blinders and Harry Potter. Her husband, actor Damian Lewis, said his wife died as she lived, fearlessly. Helen McCrory was only 52 years old. When we come back, the long walk in Windsor where Prince Philip is remembered as a man about town. It is the eve of Prince Philip's funeral, and today the Prime Minister spoke to Her Majesty by telephone.
She expressed to me how touched she was by the tributes that have been flowing in from Canada and around the world for Prince Philip. And she highlighted all the fond memories she holds of trips to Canada with him over the past many decades. Prince Philip's legacy of service will be long remembered here in Canada, especially in his work to empower young people.
So many memories. Her Majesty has also been sharing photos from her personal album, including this candid shot from 2003 taken not far from their Scottish residence, Balmoral. And in the historic town long considered home, CTV's Danielle Hamamjian on the people remembering the prince as a neighbor and a friend.
There are two sides to the town of Windsor. The one the world peeks into when the royal family makes global headlines, and the tight-knit community Prince Philip said was his real home.
The royals have a residence for just about every season, every occasion. Buckingham Palace is the headquarters, surrounded by multi-million-dollar apartments. Windsor Castle is a different story.
Literally next door to the castle is a pub managed by Stuart O'Brien.
You'd always acknowledge the flowers and always say how nice they were. Yeah. But then said to Robert once, the owner, said, but your sign on the top is very flaky and it needs to be replaced.
And while the Queen could be spotted around town behind the wheel, when O'Brien would hear that sound, the clippity-clop of the horses, he knew it was Prince Philip driving his beloved carriage nearby. 3 to 4 times a week, he would see him waving at a distance.
I had groups of tourists here looking at the castle, and then his carriage would go past, and then they'd be like, no, it couldn't have been him. And we're like, it was. And then they start running down the road trying to get a picture.
The pub, which is also a favourite among Canadian Mounties, is rumoured to be where the Duke would come drink in the 1950s after his polo matches. That certain royals got up to no good here might actually be true. Inside the castle, where Prince Philip was once given a tour, one room out of 1,000 stands out.
Prince Philip famously said he was being taken and shown around Windsor Castle by someone, and they were in the tapestry room, and they said, oh, and sir, this is the tapestry room. He said, I know, my mother was born here.
She was born at the far end of that corridor behind him in this 2017 portrait. It was meant to depict his life journey, his final farewell. Danielle Hamamjian, CTV News, Windsor.
Truly a remarkable life. And first thing in the morning, the CTV team, along with special guests, including former Governor General David Johnston, will be part of our special coverage of the funeral for His Royal Highness Prince Philip, beginning at 8 Eastern, 5 Pacific. So I hope you'll all join us bright and early for this historic occasion. Good night, everyone. See you in the morning.